All right, good afternoon, everyone. I'm Sarah Leahy, Director of Member Services here at the Colorado Rural Health Center. Thank you, everyone, for joining us for our webinar today on 2022 Open Enrollment End of Enrollment Details. It will be presented by Bailey Dvorak, Senior Policy Analyst at Connect for Health Colorado, and they will cover the end of the enrollment period, special enrollment periods, and how they can connect with rural communities and be a partner. Connect for Health Colorado is Colorado Rural Health Center's organizational sponsor at the modern level, and we are super thrilled to have them on as a partner and a trusted resource for you. So please be sure to reach out to them, work with Bailey and her team with anything that you all need. We're very grateful for all of you living and working here in rural Colorado that you're able to take time out of your day today to sit in on our webinar. Just a couple of small housekeeping things I wanted to share. To ensure a quality recording of today's webinar, please mute yourself unless you are asking a question or sharing information or a comment. Bailey will have time to answer questions either throughout the presentation, and Bailey, you can give us that direction, or at the end. And I will for sure be able to share her slides and the recording following this webinar. Feel free to chat in any of your comments or questions at any time in the chat feature. And of course, we encourage you to join us via video today, but definitely not mandatory, whatever you're comfortable doing. So with that, I have the pleasure of introducing Bailey from Connect for Health Colorado. Go ahead and take it away, Bailey.
Thank you, Sarah. Hi, everybody. I am, as the wonderful introduction that Sarah gave, I'm Bailey from Connect for Health Colorado. And I'm here to just really briefly talk to you guys today about the end of open enrollment and what we have coming up. So hold on, next slide. So just a general, of who we are, just a general reminder, we are Connect for Health Colorado. We were established by the Colorado General Assembly as a public nonprofit entity as the state's health insurance marketplace. So we opened on October 1st, 2013 for our first open enrollment to help Coloradans purchase health insurance and get financial help to reduce those costs. Open enrollment is every year from November 1 through January 15th, so it does end in 2 days. But I really wanted to highlight to this group that for this year, there was a special enrollment period proposed by the Division of Insurance from January 16th to March 16th for those affected by the wildfires and COVID-19. So this means that you do not have to have, you can enroll in coverage without having to, have any sort of documentation or anything. And the coverage will start the first of the next month. So
Can I throw something in there, Bailey?
Yeah.
I'm Jess Smith. I'm the outreach manager at Connect for Health Colorado. And I just like to point out when we talk about who we are, we administer the Affordable Care Act in Colorado. So when the Affordable Care Act was passed, states could create their own marketplace or go with the federal. And Colorado chose to create our own, and that's who we are. And so if you don't know about the Affordable Care Act, it was really created to provide financial help to folks who don't get financial help in any other way. Like they are not getting any help from their employer and they don't qualify for Medicaid. So they just, they're on their own for paying. So this is people who are small business owners, self-employed, retail workers in agriculture and farming, things like that. So they just don't have any health insurance from an employer and they don't qualify for any state program, so they're on their own. That's who we represent.
Yeah, thanks, Jess. I just wanted to again highlight that there will be another special enrollment period across the state beginning on January 16th. Most likely, it was proposed by the division and should be finalized shortly. But otherwise, open enrollment does end in a couple days, so we're encouraging folks to enroll in coverage if they can. So to what Jess said, we kind of have, what we provide to Coloradans. We are the only place that folks can, get financial help, including tax credits and cost sharing reductions. We allow customers to easily compare different plans across multiple insurance companies. And we are because we administer the Affordable Care Act, we have only qualified health plans on our exchange, which means that we follow all the rules under the Affordable Care Act. So free preventative visit every year, there's a cap on cost sharing, that sort of thing. And a statewide network to support customer service representatives. We administer and kind of oversee assisters and brokers across the state to help us really help folks enroll and to make insurance a little bit more understandable. So I did put this map in here. All of these dots are where we have enrollment centers or brokers or places to help people enroll. The black kind of stars are the ones that we've added in the last 6 months in rural areas. And we really need your help, getting the word out in rural areas and being able to help people assist with coverage.
Right. And one thing I'll add is, when we are on these calls, we like to point out, if you have folks already doing enrollment type services for like Medicaid or something, for like Medicaid at your clinics or your health centers, you can become one of these sites by doing like a day or two training online, and then you can enroll folks also in health insurance. So when you have folks coming in and your enrollment person tries out Medicaid, tries to enroll them in Medicaid and they don't qualify, the next thing they can do is say, well, let's try Connect for Health Colorado, because we can probably find you an affordable plan on the health insurance marketplace. And then if you're not in a place to be able to offer those services, we can also connect you to the site nearest you, and then you have a warm referral line. So you can say, oh, well, you didn't qualify for Medicaid, but why don't you give a call to, San Juan Public Health or whoever is nearest you, and they'll walk you through the process for Connect for Health Colorado. So that way you have options for those folks who aren't qualifying for Medicaid and don't have insurance.
Yeah, thanks, Jess. And going over to what we just said, what is the Assistance Network? So we want to make everyone aware that there is either someone in your neighborhood or maybe someone who does enrollments in at your clinic that could become an assister. So we want to make sure that they just provide education around health literacy. They offer assistance with financial applications. So people who are enrolling, especially in rural areas, understand that they don't have to pay tax credits back and, things like that. So they really understand how beneficial this program is if they do not qualify for Medicaid. A lot of assisters, like I said, do support their local communities with enrollment for us here at the marketplace at Connect for Health and with Health First Colorado. And so they've seen a lot of complicated situations. So when Jess was referring to that warm handoff, those assisters have seen pretty much every situation you can probably throw at them. So they know exactly what to do and they are well versed. So we have, if your organization would like to become an assistance site, we have two different paths. We have a funded assistance site or a certified application counselor organization. The funded assistance site is we actually at Connect for Health will provide your clinic or hospital funding to enroll people in marketplace coverage. And so we will go through the training. They are awarded a 2-year contract with budget approval. And we will have to track goals and reporting requirements for those. The CAC is a little different. You go through the same kind of training and you're able to enroll folks in Connect for Health Colorado plans. It's a little bit less of reporting and work plans and budget approvals because they're not funded, but both are options. One thing to note right now is that currently the application is closed to become a funded assistance site, but that will reopen this May. So if anyone is curious on how they can get started as a CAC site and then we can roll them over into a funded site, we're certainly happy to do that, and they can apply to do that starting in May, and then we will grant those applications. And then your site could be funded by Connect for Health, and an employee could be funded through us. So definitely, if you're interested, we can onboard you now as a CAC site and then apply when that cycle opens. So there's a lot of, we have another link about, location requirements and criteria that we've attached to this presentation. I won't go into the details of, what those are per se, but I definitely wanted to attach this, and Sarah will send out the slides along with Jess and my contact information if anyone has any questions. And then, just a quick overview of, what it takes to be a CAC or a funded site, starting with the CAC. Here's a little checklist on what would be the, the most immediate next steps. And like I said, we're more than happy to connect you and make you a funded assistance site when that application opens. And we, as long as you guys have questions or any questions about this checklist, you can reach out to us. So, we wanted to pose these questions to anyone on the call or anyone, out there, and, does your organization provide assistance? Usually rural health clinics and centers have someone who is like an intake coordinator or someone who checks insurance after they come into the clinic. Or a patient access representative, and those folks are usually the most ideal candidates to become an assister. And we have a few questions here that maybe you can just take back and think about to see if you would be a good fit to be an assistance site in the future. And that is the last slide that I have. So I'm open to questions from you guys, and then we can send out these slides. We can send out these slides to Sarah to get out to everybody, and we can drop our contact information in the chat. And I'll have Jess drop hers as well. And then we can send these out, but I'm happy to answer any questions that you guys have for us. Just look out for more information from the Division of Insurance about a special enrollment period starting soon, for open to everyone who's been affected by either the fires or COVID, which is really everyone across the state. So we want to encourage people to get covered.
Yeah, and I'll just reiterate my point from the beginning that we understand with this pandemic and, this most recent surge that a lot of health centers, health clinics, hospitals are, there's been staffing issues, and we're not blind to that. And so we realize it might sound silly us saying like, hey, you should hire someone to enroll people, or, or sound silly saying, why don't you add something to someone's plate? Because we know you guys are, a lot of the staff in these settings are inundated and at capacity. So we want to be here as a resource as well. So we just want you to have this information in case that it ever is an option for you, or if it's an option right now. But if it isn't, we have solutions for you. We have warm handoffs. We have contacts so that, when someone comes in and doesn't have health insurance, you have somewhere to send them that you are confident will help them make sure they get everything they qualify for. So we're a resource for you however you need us.
Well, Bailey, if I can kind of start us off with some questions. As far as becoming a funded assistance site, is that the same kind of training that you mentioned a little earlier in your presentation, kind of the train the trainer program?
Yeah. So becoming a funded assistance site, you would go through the training. We encourage you to kind of sign up as that CAC site, the assistance site right now, so that you're all trained up and ready to go and just ready to apply to become a funded assistance site for you and your you and your organization. And so yes, it's the same training for both. Their training will require a manager to take the training, and the actual employee going to be doing enrollments take the training. So the manager can kind of answer questions or kind of address or have a point of contact. But once you designate those two things and you go through the training and become a CAC site, it's seemingly very easy to just apply for that funding. And we are looking, to expand our presence in the rural communities of Colorado. So we want to make sure that, as Jess said, we want to make sure you're supported in whatever ways that we can help you, get those third-party payers into your clinics, into your hospitals, and vice versa. So we're here to answer questions, and we're here to, make that transition as easy as possible.
Awesome, thank you. And are those trainings, how long do they take? And are they in person or virtual or both?
They are all virtual. All the trainings are virtual. And it takes about, I think about a little over like a day and a half. Jess, correct me, but I think it's total day and a half, and you can spread it out whether you want to do, 2 hours here, 2 hours here. It's not something that you have to do all at once, but over the course, it's probably like 10 to 12 hours of, training material to get through. And then, like I said, you can spread that out however you need. We understand staffing issues, and we don't want to overload anyone else's already full plate. So if you need to spread it out, they're fine with that as well.
You had mentioned kind of a list of, or showed a map of the current assistance sites around the state. Is there a downloadable or kind of a spreadsheet of all of those sites and contact information that we can share with members?
There is on our website, you can search by zip code. So if you go to our website, which is connectforhealthco.com, it says we can help. And then you just click find an assister, and you can put your zip code in, and it'll pull up all of the sites in your area and show you the exact distance they are from your zip code.
Yeah, and we've come to find out that some rural, a lot of our assisters that are currently active do virtual appointments because of COVID, which is actually really nice because they can go to other parts of the state. But what is tough is we have found with some of the assistance sites that we have added in the recent, in the last 6 months, those black star like shapes, that they didn't have assistance sites for, quite a ways away, especially in Holyoke and Hugo, and some of those places. And it was a lot easier to know someone in their community who knew how to enroll somebody or could answer their questions, who they trusted. So while, virtual appointments are always an option, we've seen that being in the community has made a difference. So just something to think about, but we wanted to open to any option.
Well, it looks like that's all the questions for now. But Bailey and Jessica, we are so appreciative of both of you being on today. And thank you everyone who was able to participate on the webinar. Like I said, we will have the slides and the recording of the presentation to send out, and we'll also post it on our website with our Connect for Health partnership on there. Please reach out, like Bailey and Jessica said, to either of them if you have any questions. And Bailey and Jessica, I will include you in the email CC'd so folks can just email you directly when I send out the slides and the presentation.
Great.
Yeah, that would be great. Thank you so much. And thank you guys for, it was kind of a quick little webinar, but we wanted to make sure that, we helped get the word out before open enrollment ended in a couple days, and then make you aware of the special enrollment period coming up until March 16th. So we could, keep enrolling those folks. If you're interested in becoming a CAC site, please reach out. We're happy to connect you with our assistance network and get all of your questions answered. And then, like I said, that application to become funded is going to be available in May. So we're really excited to partner with the rural health centers, and we wanted to share this information. So we will share the slides out and be open to any questions. Thanks so much, guys.
Thank you.
Thank you.